This is TPA administration at Holy Spirit Hospital for RN education. This video is to help you understand how to program the Alaris pump to administer Alteplase or TPA to a patient who is having an ischemic stroke. This video is being recorded on January 30th, 2015 and is applicable to care provided at Holy Spirit Hospital, a Geisinger affiliate. Please make sure that you're referring to the most current education and the most current policy regarding intravenous and critical medication administration. You should also always be certain that the most current stroke practices are being followed. This would include indications, contraindications, warnings, and current nursing practice when caring for our stroke patients. This video will only address the process of programming our IV pump. So let's get started. My TPA has been delivered for my stroke patient by pharmacy. I have my pump here and I've already run it through and attached it to my patient's arm here. I'm going to start by turning on my pump. And we wait. And now I'm going to start programming it. So I'm going to confirm that this is a new patient. Yes, this is a new patient. Is this patient in critical care or the ECU? Yes, they are. I hit yes. Now I'm going to put in my patient's medical record number or ID number. This is a very important process. I confirm it. That's the only way we can follow up with this patient. Now I'm going to turn on my channel. I'm using channel A, so I turn that on. And I'm going to come back over here and choose a guardrail drug. Now TPA is a high alert medication, so I'm going to have another nurse double check my programming. I'm going to search for my medication. I could do it one of two ways. I could do it alphabetically or I could just scroll down. I'm going to scroll down and I choose Alteplase or TPA. You can see here I get multiple choices, MI, pulmonary embolism, stroke, all of those are indications for TPA. I'm going to choose stroke because my patient is having a stroke. I double check and confirm that that is what I wanted, Alteplase 100 milligrams and 100 milligrams, because that is the way ours is delivered, and we can see that right on our vial here. So I confirm yes. It gives me a clinical advisory that tells me that this is a high alert medication and that this patient might start bleeding with this. I confirm that I have read that clinical advisory. Now I'm going to input my patient's weight. I'm going to get that off of our electronic health record and I'm going to double check that along with what is on my bottle here. My patient weighs 78 kilograms. So I put that in, I confirm it by hitting next. Now I'm going to put in how much is going to be infused. On my vial here, it tells me that my patient is going to get 70 mLs. That would be 0.9 milligrams per kilogram. So he's getting 70 mLs volume to be infused. And now I want to press bolus. And then I want to press start. Before I do that, Chris, I need you to double check that I have programmed this correctly. Okay. Thank you. I press start. Now what's going to happen is my pump is delivering the first 10% over the first minute. Once that has been completed, it will go into the infusion and you will hear the pump give a little beep to tell you that that first bolus has been given over a minute. The rest of the infusion will be given over the next 59 minutes, making a total of 1 hour. I like to stand here with the patient with my hand on the pump so that I am conscious and aware of when that bolus has been completed. I can talk to my patient, I can inform the family of what is going on and what to expect from now on. We might be doing some more assessment points, but mostly I am paying attention to this infusion to make sure that it is going in properly and he is receiving that bolus. And right there, it converted over to the drip. This drip will continue for the next 59 minutes. I will be staying with the patient for that entire time, taking his vitals every 15 minutes for that hour.